In a world filled with microscopic invaders, herpes stands as a common yet often misunderstood adversary. This ubiquitous virus comes in two primary forms: herpes simplex virus type 1, typically associated with oral infections, and herpes simplex virus type 2, often linked to genital infections. Though they may differ in their preferred realms, both types share a similar modus operandi. So, how does one encounter the likes of herpes? The virus, a master of disguise, often hides in plain sight. It spreads from person to person through direct contact, be it a casual kiss from a loved one or during intimate moments. It's a silent invader, often slipping into our systems unnoticed. Risk factors for herpes infection are varied. Close personal contact with an infected individual, unprotected intimate encounters, and having multiple partners can all increase the likelihood of crossing paths with this microscopic foe. Now imagine Misaki, a vibrant woman in the prime of her life. A chance encounter at a party led her to cross paths with herpes. Initially, she noticed a few blisters. Then came the fever, the swollen glands, and the aching muscles. Misaki, like many, was caught off guard by the unexpected intruder. Diagnosis of herpes often involves a physical examination and laboratory tests, such as a PCR test or a viral culture. Misaki sought medical advice, and with a swift diagnosis, she began her journey to manage her new reality. The psychological and social challenges associated with a herpes diagnosis can be daunting. Misaki experienced this firsthand. She grappled with feelings of shame, fear, and isolation. But it's crucial to remember that herpes is a medical condition, not a moral judgment. Misaki started to realize this and began to seek support from counseling and online communities, slowly reclaiming her life from the clutches of stigma and fear. As for treatment, while there's no cure for herpes, antiviral medications can help manage outbreaks and minimize the risk of transmission. Misaki started a regimen of antiviral therapy, which helped her regain control over her health. Prevention, of course, is always the best strategy. Condoms can reduce the risk of transmission, and regular health checks can ensure early detection and management. This tale of Misaki serves as a reminder of the importance of correct knowledge and management of sexually transmitted diseases. Understanding herpes, its transmission, and its management is not just a personal matter, it's a social responsibility. In a world filled with microscopic invaders, equip yourself with knowledge, because knowledge, after all, is the best defense.